Okay, good evening, everybody, and welcome to East Bridgewater Board of Health meeting, Monday, March 4th, 2024. We're going to go just a little bit out of order on the agenda, but we'll get back on track. We have some new regulations from the state as far as tobacco enforcement. And do either one of you two want to introduce our guests?
We have on a Zoom call Sarah McLaughlin from Tobacco Control Program and Patrick. Sorry, Patrick. You're new to me, too. Patrick Martin.
Okay, Sarah and Patrick, welcome. I appreciate you taking the time and joining us tonight. Kind of give us a little bit of an overview of what's changed and how we can help. So I'm just going to pass it back to you, Patrick or Sarah, whoever wants to take the lead and start.
Is it only supposed to be audio? I don't see any visual.
There's no visual?
No, but that's okay.
I see Patrick.
I
I
see
see
you.
Patrick and I see myself, and that's it.
And we hear your beautiful voices.
So we are on cable
Nope, I'll get you.
TV also, just to
Okay,
let you know.
See us now.
There we go.
Okay.
Thank you.
Right, sounds good. I'll just give a brief introduction of myself, and then I'll pass the mic over to Sarah. My name is Patrick St. Martin. I am a prevention coordinator with Bay State Community Services. Specifically, I am the Greater Boston Tobacco-Free Community Partner. I am also a Bridgewater resident. You guys are East Bridgewater, you guys are right next to me. I do go to the YMCA though. But, and I'm just hoping that we can collaborate so we can attack some of the tobacco nicotine issues in the community. And we'll pass it to Sarah.
Thanks, Patrick. I'm Sarah McColgan, and I'm the director of the Tobacco Control Program for the Massachusetts Health Officers Association, which, as you may or may not know, is the trade association for the health department staff across the Commonwealth. And I provide technical assistance to local boards of health to assist them in developing policy that will, as Patrick said, hopefully tackle tobacco, nicotine, vaping issues, things like that. And so I'm here because the Department of Public Health was contacted by a West Bridgewater resident, and she may be on. I forwarded her the link, but she may come on. And she's concerned, she was concerned about the situation at the West Bridgewater high school, middle school level, and generally what's going on. So I've been talking to all three Bridgewaters about tobacco control issues and looking at your regulations and hopefully being able to work with your board to revise those regulations and bring them at least up to the state standard, and anything beyond that that you as a board may want to do for East Bridgewater.
So is that it? Is that pretty much?
That's who I am.
Okay.
If you'd like me to talk about the regulation, I'm happy to do that, or answer questions that you may have. If you folks have already reviewed, I did provide Jean Marie with a sample regulation back in the fall. If you've had a chance to look at that, I can answer questions regarding that.
So can you speak to what's changed as far as the state and what disconnects are in our town and or some of our neighboring communities, but obviously we're concerned about East Bridgewater.
Right. What changed at the state level in 2019 is that a few things that you had already implemented. You already, I believe, put the age for tobacco sales at 21, so that became a state law. And maybe you still have 18 on.
No, I think it's 21.
Yeah,
Our-
yeah, we're 21.
Yeah, 21, although I am seeing kind of a disconnect on the third page of your regulations where it's pursuant to grandfather, where you grandfathered in some grandfathered in folks, I guess at that point, and that's not allowed under state law, but that's probably been taken care of as time has gone on. So the state law established the age of 21. They also established that in Massachusetts, the sale of all flavored tobacco products was prohibited. And that includes menthol, mint, wintergreen. And that's not only combustible flavored products, but it's also flavored products that can be vaped. And that's the big issue with kids is the vaping products. And now we're kind of moving a little bit out of the vaping products and into nicotine pouches that they keep in their mouth and suck on. And many of them are flavored also. But so also within the state law is a requirement that a convenience store can only sell electronic products with a certain amount of nicotine in it, and an adult-only tobacco store where young people are not allowed in can sell a higher level of nicotine, so kind of like a regular gas and high-octane gas, and the convenience store can only sell the regular gas. Also, any sale of tobacco products to anybody, regardless of their age, the person is required to produce an identification, and the retailer is required to ask for identification. So that's new in the state law.
Okay, when you say new, do you mean from 2019 or newer?
From 2019, the state has not addressed anything since 2019. The 2019 law took effect in June of 2020.
So all tobacco products are supposed to be ID'd regardless of, I don't look 18 anymore.
And I don't either, so regardless of how much gray hair we have, if we're buying a tobacco product, we're supposed to be asked for ID. Just like when you go to Gillette Stadium, or you go to the Boston Garden, go to Fenway, and you're going to purchase a beer, they are required to ask you for ID.
Well, I think though, I could be wrong, but I thought some of those, I don't want to use the word regulation, but I thought that was more internal of the, gaining a favorable insurance policy by making sure that everybody is carded, that it wasn't, I'm getting off track here.
I don't know if it's a law that to be able to buy alcohol at Fenway, you have to be asked for ID. I know that that's their policy. It may be a state law, but I don't know. I only deal with tobacco.
Okay, but
It
just
is a law that nobody is allowed to purchase a tobacco product without having produced their ID, which proves them to be at least 21 years of age.
Okay, and then, can we go back to the flavored for a minute?
Absolutely.
So I understand that all flavored has been banished, if you will. But I see signs on doors, on entryway doors, that say, menthol flavor without the menthol, or something of that effect. So
Yeah,
how do we manage that?
That's probably a product called Newport Non-Menthol, and it's being marketed in two states in America. One is California and one is Massachusetts, because we both have regulations prohibiting the sale of menthol. So it is a difficult situation at first to deal with, but it's gotten sorted out a bit over the last year. The tobacco industry claims that this is not a menthol product, that it has a chemical in it called WS3, something similar to, or maybe the same chemical that's in menthol shaving cream and menthol toothpaste, things like that. And the industry claims that it produces a sensation and not a flavor, not a taste. And so we disagreed with that, and the city of Chelsea decided that they were going to consider the Newport non-menthol as a flavored product. They had their tobacco control person go out and do the enforcement on it. The industry appealed, or the retailers appealed the fine. I think there were 3 retailers, and they appealed their fines. And when they came to a Board of Health appeal hearing, they were also joined by 6 attorneys from a very expensive law firm, Jones Day. And these attorneys did most of the arguing and the presentation and everything, and the retailers were just there, you know, the attorneys did it on their behalf. And so the Chelsea Board of Health heard both sides of the argument and determined, based on the information that was presented by both sides, that they were going to uphold the fact that the Newport non-menthol is a flavor. And so enforcement in Chelsea at least has continued. We expected a lawsuit from the retailers and backed by Jones Day, or a lawsuit from the tobacco industry, but time limit has expired and no lawsuit was filed. That's not to say that if it isn't enforced in another municipality that maybe doesn't have the capacity to defend themselves in a lawsuit, it's not to say that the industry wouldn't file a lawsuit against East Bridgewater if you went and enforced that. So we're not recommending that enforcement be done on that product.
Okay, that's what I was waiting.
Yeah, but it's
Okay.
basically just that product. So all the other flavored products, you know, they may not say grape, but purple this and pink that and fusion and casino and everything else. It's all terms that the industry uses for various flavors of products. So those are all banned, with the exception of about 26 smoking bars in Massachusetts. And obviously you don't have one in East Bridgewater. And I don't even think that there's one in Bridgewater. Worcester has a great number of them, and Springfield has a great number of them, and then there's a few smattered around Boston and a couple other places. But there's only 26 places in the state that are allowed to sell the flavored tobacco products. One of the other requirements with the 2019 law is, and it's based on the flavor, is that manufacturers need to provide to the retailer a letter certifying that all of the products in that manufacturer's line that the retailer sells are not flavored and comply with Massachusetts state law. Now, the retailer gets that letter from their wholesaler, so it's not like a retailer has to figure out where the manufacturer is or anything else. They just ask their wholesaler for it, and their wholesalers got those letters handy because they're being provided to almost 7,000 tobacco retailers in Massachusetts. So that's another thing that's new within the 2019 law. And I think the biggest thing is that the fining structure has changed. There are probably about 18 to 25 different things within the state law that, that the state has decided to institute a very high fine on. The first violation would be $1,000. The second violation would be $2,000 and a possible permit suspension. The third violation within 2 years would be $5,000 and a possible permit suspension. So those are for things like selling to somebody under 21, selling flavored tobacco products, having an unlocked humidor or a self-service display. And so those types of violations get the higher fine, whereas there are other violations that are local policy decisions that you as a board would make, like, let's see, banning blunt wraps.
I'm sorry, banning what?
Blunt wraps.
Oh, blunt wrap, okay, gotcha, yep.
Yeah, you familiar? Okay. So there's you know, a number of other violations that are local policy decisions, and the board can either fine at a lower amount that you've probably already got in your regulations now, or they can decide to use what we call a unified fining structure and fine according to the state fines across the board, regardless of whether it's a state violation or a local policy violation. The fines have been increased significantly, so there's been pushback from retailers on that. I know boards feel different ways about it, but basically it's the state law, and there's no wiggle room. So if there's an infraction that has $1,000 fine, the board is not able to say, okay, well, we'll only fine you $100. It's the state law, and you know, we all live with that, and it's done well to you know, to hopefully reduce sales to minors, reduce the sale of flavored tobacco products, and all of the other things that we're trying to look at, and so that's why the higher fine is there. I mean, Massachusetts has been doing tobacco control for almost 30 years, so it, to me, seems kind of strange to fine somebody $100 like we've been doing over 30 years to selling to a minor. To them, to a lot of retailers, it's just the cost of doing business if they get slapped on the hand with a $100 fine. For $1,000 fine, or if they're up to a third violation level, a $5,000 fine, they take notice, they train their employees more adequately, or they, you know, may ask folks at the state level for assistance in training their employees, and take it more seriously.
Okay. So these changes go back to 2019. Do you recall, or do you have any insight as to how this was communicated to the retailers, or was it, or?
Yeah. Okay. Right after the governor signed the bill, which would have been December of 2019, the Department of Public Health sent out announcements to all licensed retailers in the state. And these are folks that have state licenses as opposed to your local permit. So in order to get your local permit, the retailer needs to have a state license. So everybody on the state list got 2 different communications right away regarding the law, talking about the different types of retail establishments, whether it's a convenience type store or a store that is for adults only, or whether it's a smoking bar, and what is allowed to go on and what is prohibited in each of those 3 types of establishments. So they got information on that and a very easy to understand chart on that. They also got information on and a chart on which signs that are available for free to retailers, need to be posted in each of those 3 types of establishments. So they've gotten those things. They've probably also gotten additional things, over time from the state. But those 2 mailers went out
Okay.
right away to everybody in the state.
Okay. I don't have any other questions.
Nothing from me?
You good? Mm-hmm. Okay. Patrick?
If I just want to add anything to it, it's just realizing that, especially when it comes to the youth, the vaping issue is something huge right now. A big step that we made is what we just discussed, why we changed the age to 21. But the reality is the youth are still purchasing. Like I said, I live in Bridgewater. I'm not just a prevention coordinator. I'm a parent too. I have a 19-year-old, I have a 13-year-old in middle school, and we all know what the middle schools are like. So I think we just have to figure out our best way. There's inspections, there's compliance checks, there's ways that a big thing that we need to do is making sure that we're blocking the access.
Right.
Blocking the access is a major start. It's not the only thing, but it's a major start. So we just have to we have to be on point, because there's many stores in not just East Bridgewater, but East Bridgewater, Bridgewater, West Bridgewater, who are still selling these vapes to minors.
How-
Who still have flavored products in the stores.
It just seems to me that both alcohol and tobacco are both now at 21, correct? So that they both have
Yes.
the same, and a lot of, from what I've seen here without a deep dive, you're not going to be able to buy a 6-pack without a license or some form of identification, but yet, from what I'm getting from you, Patrick, and from what I'm hearing, is that minors have an easier time obtaining nicotine in whatever format they want. And is it a function of adults buying it for them, or just, again, the stores just not paying attention?
It's stores. I have, for example, I said having my oldest son, we have the friends over, and trust me, I have my own focus groups and questions that I ask when I see them with their vapes. And they are purchasing these vapes themselves, and they are not 21 years old. I stopped confiscating because they started calling me the feds, so I just tried to educate them. But I do like to ask these questions, and they are purchasing them themselves.
All right.
Yeah.
Okay. Jean Marie, anything?
Just a quick question to both of you. Are they purchasing them physically in stores, or is this an online?
Both.
Oh,
Both.
okay.
Yeah.
All right. No questions.
Thank you.
Thank you.
So our ask is that you consider updating regulations. It's not a heavy lift for Jean Marie or your staff to do. I would update and come back to you with a draft regulation, and we would go back and forth until you were happy with that draft. And at that point, we would take the regulation to a public hearing so that the folks in East Bridgewater and particularly the retailers would know that these are regulations that the Board of Health is considering, and go from there. Patrick did mention inspections and compliance checks, and you are not part of a regionally funded tobacco control program in the state. The state unfortunately doesn't have enough resources to provide inspections and compliance checks to every municipality. However, we have a contract, MHOA has a contract with the Department of Public Health, and if you were agreeable to revising your regulations and at least bringing them up to the state level, and possibly, looking at a little further than the state level, MHOA would provide you with an annual inspection and an annual compliance check at each of your tobacco vendors
So that would
at
be,
no cost.
that would be a percentage of our storefronts or every storefront?
Every tobacco vendor that you have permitted. So that's one of the first things we would do is get a list of your permit holders from Jean Marie, and every one of those stores would be visited at least once. If they sold during a compliance check, they would be visited again for a second compliance check.
Okay.
And they would also have a retail store inspection where our inspector would go in, make sure that they're not violating in any way. Generally, the store inspections tend to be more educational, although if the retailer is selling flavored products, then obviously there would be a sign associated with that. But if they were missing signage, things like that, they're not gonna get fined for that. They're gonna be provided with anything that they're missing.
Gotcha. Okay, well, that sounds helpful. Okay, I don't have anything else. Anybody else? Okay, guys, I really want to thank you for your time and jumping in here on a Monday night and bringing us up to speed on what the state's been doing. And we're missing a member tonight. So when we get our next meeting, we'll probably have a little bit more robust discussion when we have all three members here, and then we'll plan accordingly.
Would you like us to be on your next meeting in case your other member has any questions?
I don't think that, I think what you've been able to provide to us, if Tom has any questions, I think we'd be able to answer them. You know what I would like to get my hands on is, if it's still around, that chart and/or document that went out in December 2019, or whatever we send out to, I would imagine if somebody, if the store changes hands or ownership, I would imagine they would get a package as well.
I'm not sure about that, to be honest with you. I don't know if that's sent out at the state level by the Department of Revenue or not. It's on, all of that information is on the Department of Revenue website at mass.gov, and very easy to find, but I'm happy to send a copy of all of that over to Jean Marie, and she can forward it on to you folks.
That'd be great.
All right. Thank you guys for letting us join. I realized that we took your whole entire meeting, so I...
Almost. No worries, it's worthy cause.
Thank you.
All right, folks, thank you very much. Have a good night.
Thank you.
Night, Sarah. Night,
Bye-bye.
Okay, so she's gonna get us the letter and all that. Approximately how many do we have in town? License, nicotine, ballpark?
I'm gonna say about 10 to 12.
That's it?
I think we have 5 liquor stores that don't sell food, so they only have tobacco permits.
Yeah, okay, all right,
And then the rest are probably the convenience stores.
okay.
Yeah. I've got some signs upstairs that I pass out when someone's missing them.
Okay, so we're gonna get back on track with our
Agenda?
with our agenda here. And then, before I jump into this, I don't wanna, I see some folks in the audience here.
They're 132 Old Plymouth Street,
Okay,
coming in for septic and a well.
okay.
So they're basically for the well part.
All right, so let's just see if we can move this along as quickly as possible. We have 2 invoices tonight, both for our health agent, Jean Marie. First is mileage is at $214.85, and the second is for reimbursement for postage of $35.98. I'll make a motion that we accept and pay this as presented.
I'll second it.
Okay, motion Lyons, second Andrew. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. Okay, the minutes from February 5th. Okay. I'll entertain a motion to accept the minutes as presented.
I'll make a motion to accept the minutes.
Okay, motion Andrews, second Lyons. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. How many local upgrades do we have? Quite a few. Okay, so Jean Marie, we've got some local upgrade approvals here. The first is 435 Highland Street in East Bridgewater.
Yep, they're requesting a reduction in minimum groundwater from 4 feet to 3 feet. It would allow a construction of a leaching field in the backyard and not raising the grade so high that it creates a runoff issue.
Right, okay, all right, so that's an easy one. Okay, 133, 135 North Bedford Street.
Right,
We've got
this-
quite a few on here.
It does. This is a property that's right south of the grill, Standish Grill,
Yep,
and Mary Lou's News. So there's a tiny spot. It's got some grade changes. They're asking for reductions to maximum groundwater, basically, for the inlet and outlet teeth of the septic tank pump chamber, provided that all the bolts and joints are hydraulically sealed. Allow a reduction in size. Separation to groundwater from 4 feet to 3 feet.
okay, so what bullet point is that?
Number 2,
Number 2?
Dock 2, see it? Fourth line down.
Yeah, no, okay, I just didn't see the separation listed.
And then 3 is the separation to groundwater.
Oh, that there. it is.
Lines
That's-
down from there.
Okay,
Number 4 is an increase in maximum allowable depth of components from 36 inches to 48 below finished grade. Usually they have to be within 3 feet to grade. This is where the pipe comes out of the house there. And a reduction of the required setback between the proposed leaching and foundation wall from 20 to 10 feet. They're gonna put in a black plastic liner for that. And we only got one hole in there because of the pavement and the house. Next one's 13 Cross Street, East Bridgewater. Reduction between the bottom of the leaching area and the high groundwater from 5 feet to 4 feet, and 1 deep hole. Then a local upgrade, 170 West Union Street. Reduce the setback from 4 feet separation from groundwater to 2. Use of 1 deep hole, and the use of a sieve analysis. He's doing advanced
okay,
treatment.
I'm sorry, you said sieve analysis?
Yep. He's doing advanced treatment on that one.
There it is,
so
okay, got it.
they can go down to the 2 feet to
Yep.
groundwater. And the last one for repair is 274 West Street. Local upgrade approval from 4 feet to 3 feet, or 4 feet to 3 feet, and a variance allow the use of a sieve. So that's the 1, 2, 3, 5 repairs that we have requesting variance.
Okay, we'll take these, so I've got 1, 2, 3, 4, 5. Okay, so I'll make a motion that we accept the 5 local upgrade as presented and discussed.
I'll second that motion.
Okay, so that's motion Lyons, second Andrew. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, passes. Okay, so now we've got some new construction.
No variances, they're new
Okay.
construction. So 19 Daisy Lane, 21 Daisy Lane, and 0 River Road Extension.
So is that way down, that's the last,
It's on the left-hand side, I think.
all the way down the end?
Yep.
Okay. All right, so let's see, food establishments, Z Golf Food and Beverage.
Did we have a motion on that? You guys
On
gonna,
the new construction?
new construction?
Oh, okay, I'm sorry. I'll entertain a motion, we accept the new construction as presented for 19 Daisy Lane, 21 Daisy Lane, and 0 River Road Extension.
I'll make a motion to accept them.
Yes, motion Andrew. Second Lyons. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. Okay, so Maryville Gardens by Wedgewood, okay, North Bedford. So is this the old
Miraval or Mockingbird.
Mockingbird? Okay.
Mockingbird's the bar side, Miraval is the event side. So it's being taken over by Wedgwood Weddings, an event planner.
Okay.
They've been vested, both on the liquor license side.
All right, so I'll make a motion that we accept the the permit application for the food service establishment of Wedgwood Weddings, 838 North Bedford Street.
I'll second that.
It's motion Lyons, second Andrew. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, that passes. Okay, private well permit.
And septic design. Do we have a septic?
Say that again?
They also go, it's a new construction, so they
Yep.
have both a septic design, new construction, and a private well on the lot. Lots,
Okay, but the only thing that
I-
we discussed so far,
under new construction.
or that's on the docket here, is the well. Correct?
Yeah, I know that I did put in for new construction too, but we
Okay.
got kind of,
So,
somebody thought I was repeating.
okay, so under new construction, it should be 132 Old Plymouth Street as well?
Yeah, but I would take the whole lot together.
Okay, so we'll. All right.
The lot's 20,000 square feet, or 18,000 something, right?
Just under 20. Yeah.
132 Old Plymouth Street. Okay, so
All
that's
right.
down the other end of town.
Hey, Patrick, you want to be on the hot seat? So these, this is for, the well, and it has a septic, the whole plan is on plan, basically. You guys want to share, or you want me to?
Give me that, share.
On my Rob?
What's the more support?
Oh, Plymouth Street is behind Plymouth Street.
Yeah, it is, yeah.
Yeah.
Okay.
It changes from,
Condos up in here, right across from, what's it called, Pompano Pines?
mm-hmm,
Yeah. It's a tight.
I gotta pull this down a little bit on this.
So what,
So Old Plymouth, so where's the roadway on here?
should be down the bottom is Old Plymouth, and then up at the top would be where 106 is.
This is the street, this is your driveway,
Yeah, okay.
house, going up to the back.
Have we got it flipped around?
Can you introduce, how's it going? Good to see you again. Just, introduce yourself for the record.
Sure, Pat Carr from P&P Consulting. I represent Mr. Kevin Perkins.
You guys, how are you? Kevin, could you introduce yourself, buddy?
Yes, sir. Kevin Perkins, I'm the applicant on this property, 132 Old Plymouth Street.
Okay. All right, so you're putting in a duplex or one building connected, one bedroom in each unit?
Correct, duplex, yep.
Yeah.
Yep, 2 bedrooms total.
Okay. What's that?
Yes, sir.
So which would you want to go first, the septic or the well? They're two different permits.
Let's cut up here. Well, we got the well on us right now, so we'll do the,
Okay, the well has a requirement under our regulations to be at least 100 feet away from any source of contamination. So on the plan, he had to find out what was within 200 feet. So that's why you'll see circles and things like that. And it does meet that setback. There's two parts to a permit. One is,
let's come on up here and show me again.
so Patrick found out all the different types of contamination, which would be other people's septic, because the lots are kind of tiny. And then that's what these circles are.
Okay, so,
And the well's right there.
okay, that's what I was getting
And
at.
here's another one. They don't have drinking water either, so
Okay.
he goes to Bridgewater. And these people,
Right, so, okay, so is this, is this gonna be potable as well?
yes,
It will be.
potable drinking water.
All right, so we've got it tested?
No, so this permit is permission to drill.
Okay.
And then he'll come back with a well completion, which tells what kind of water he has, and then we'll sign off and decide whether or not it meets the standards for a drinking water well.
All right, so this is just a drilling permit?
Yep,
All right.
so it's like two parts, just like the other side.
Okay,
So this was basically plan approval for where he's putting it.
okay. And then what's the other, septic is where?
So his septic for this is back here, so we're
Okay, so this
outside,
is-
we're outside boundaries that
Yeah,
we need
yeah.
to be. And then these people are outside too, their septic's right here.
Okay, so this is the leaching field?
Yep,
All right.
and it's tiny and has treatment because it's in a well protection area, zone 2 for town.
Okay, so this is gonna be a small plant, if you
Yeah,
will.
yeah, and also denitrification,
Okay, so what else are we doing there?
Yeah.
a fast system, denitrification, FAST system. So it takes the nitrogen out of it in the tank before it gets
Right.
leached out into the field. And he has to do that because it not only is it hidden
Okay.
close to his well and the neighbor's well, but it's also in zone 2 for a public drinking water well.
All right. Now, do we eventually deed this?
Yes,
or-
that gets all
Yeah,
deeded.
okay, all right.
Yeah.
Yeah, you'll have a deed notice for the fast system. There'll also be a two-bedroom restriction deed notice that'll have to be filed. And then Kevin will also have to have a operation and maintenance plan in place for the fast system.
Yeah, okay. So they're putting in a plant, a mini treatment plant, if you will. So with that comes some additional guidelines. They'll submit an operational plan that says, okay, we're gonna hire XYZ outside company that comes in and maintains and checks and validates that the system's working properly. And I don't know, is that on an annual basis? That check was done, or is it 2 years?
Believe them like a faster annual.
Yeah, I believe they're annual.
Their annual,
Systems.
we get them usually at the,
So
right around
it's
December 31st,
deeded.
January 1st.
Onto the deed itself, so when they go to sell it, the new owners understand that, you know,
That's
that's
how it's operating,
That's how
not separate.
it's gonna operate. Excuse me. Okay. Okay. All right, so the first issue up is, excuse me, the authorization to drill the well or to permit the drilling. So I'll make a motion that we accept that application for preliminary drilling of the well. So that's motion Lyons.
I'll second the motion.
Okay, second Andrew. Any further discussion?
No?
Hearing none, all in favor, say aye.
Aye.
Aye, so that passes. Okay. All right, and the second issue up on 132 Old Plymouth Street is the preliminary approval of placement of the septic and the plant system. So I'll entertain a motion that we accept that permit as presented.
I'll make a motion to accept it.
Okay, this is motion Andrew. Second Lyons. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Aye. That passes. Okay. You guys are good. Are they good?
Fantastic.
Thank you.
Thank you very much.
Okay, have a good night, guys.
You too.
Thank you.
See you later.
Bye-bye.
Okay. Installer permits, we have 2 renewals. Teleros Construction and J Corporation Unlimited Excavation. on the renewals. Sandra, we,
The applications are complete.
okay, great. All right, so I'll make a motion that we accept the renewals as presented.
I'll second that.
Okay, so that's motion Lyons, second Andrew. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. And then we have one new applicant, LMH Construction Group,
And his application's
and
complete.
he's good to go, okay? So I'll make a motion that we accept LMH Construction Group's application.
I'll second that.
Okay, so that's motion Lyons, second Andrew. Any further discussion? Hearing none. All in favor say aye.
Aye.
Aye, so that passes. Okay, so we have two betterment loans. Okay, so we have two application, 50 Elab Latham Way and 15 Poor Meadow Landing. I'll make a motion that we accept those two permits or the applications.
I'll second that.
Okay, so that's motion Lyons, second Andrew. Any further discussion? Hearing none. All in favor say aye.
Aye.
That passes. Okay, state regulations on tobacco, we've had that discussion. Okay, Bridge Street landfill.
I actually have that under my health agent update. Do you want me to just?
Okay, so we can slide over that and we'll discuss that on health agent update.
It's ready for that? Okay. Site assessments, new perks, and Bob Holz's stuff at 345 Bedford Street, 35 Poor Meadow Street, 35 Fieldcrest, and 141 Plymouth, and 274 West Street.
Do I have, I'm
Land-
sorry, I apologize. Do I have a copy of your update?
Probably the very last page, I'm guessing.
It's a single page in your packet?
Probably the last, like the bottom.
Okay. Yep.
I did the same thing.
Excuse me.
So plan submitted, 1921 Daisy Lane, Zero River Extension, 132 Plymouth, repairs, 144 Liza Latham, 133 North Bedford, 170 West Union, 274 West Street. Systems under construction, 1115-17 Daisy Lane and 112 Cedar Street, repairs, 184 Belmont Street and 192 Belmont Street. Food inspections, being done all electronically. Routine food, Cakes by Tina, Joppa Grill, and today I did Fiestas. Complaint and follow-up, Honeydew Donuts. Opening or post-closures, 6 Central Street we opened, and did a post-closure at 219 Pond Street where Sophie's Kitchen just left.
Okay.
That's so that there's a listing when someone comes in and wants to operate, they know what they need to repair, fix, or remodel.
So I'd heard, again, this is just rumor mill, that
That's okay.
Honeydew on Bedford Street was going through a remodel?
Actually, I think it was through transfer, and the new person hasn't come in yet. But I zipped on down there and made sure that all the food that we'd worry about
Okay.
was gone. You know, we don't have garbage and trash
Okay.
in there. So it's been closed for almost 2.5 weeks.
Yeah, I thought that there was, so
Um,
is a new owner coming in just for Honeydew, or is the whole,
I have no,
don't know yet?
I think
Alright.
it's just Honeydews. I did get a hold of corporate, but he
Alright.
hasn't appeared yet, and we haven't approved any remodel or plans or anything. Which
Okay,
you'll be
opening
getting.
and post-close, okay, so that's, all right, so we've opened up the new Sophie's and closed the old one.
And that's because we've had a lot of people interested in what they need to do to get into 210 Pond Street.
Mhm, sure.
So it's easier for me just to do an inspection and say, you need to fix this,
Yep.
that kind
Very
of.
good, okay,
The well, we talked about already.
yep.
Housing, don't jinx me.
Oh,
Um,
I'm with you.
Complaints, we have free-range chickens, 71 Tardy Terrace. We had a problem with a septic at 73 West, and mattresses are appearing
Okay, so
because
let's,
the DPW doesn't pick them up anymore.
just real quick, because I
Yep.
know we've got okay, so the chickens, we just,
We're dealing with it.
all right, okay.
It's doing
Is this the same,
There's actually 3 sets of,
all right,
so locating and telling people to take care
okay,
of
and
it.
the West Street septic was what?
Bubbling up.
So they just need to be pumped.
and repaired, so you'll see that soon
That's a
too.
repair, okay.
On 350 Cedar Street, someone just put mattresses out, and they've been out there a while.
No joy. All right, so we've got beavers.
That's pretty great. The only new thing from that one is they're going ahead with the drone flyover tomorrow,
Tomorrow, okay.
okay? That's the pretty basic. Bridge Street landfill, nothing new. The plans went out to Sampson and Weston, and I put a call into them, and they haven't brought them back to me.
Okay,
I
there was-
really want to get rolling on that.
Yep, now, there was, I apologize for not having it in front of me, but there was a late in the day email going back and forth.
Probably when I was out doing my inspection,
Okay.
so I didn't quite get it. So anyways, it's moving. I'd like to get it out for public review and by the 1st of April.
Okay.
Emerging public health concerns, flu, COVID, and RSV are still on the increase. I'm sure you guys know that.
Yep.
I'm expecting to have big breakthrough cases of German measles and chickenpox, so Heather and I have discussed what we'll do with that. And we got notified of a positive TB case, so we're doing follow-up as required by that. Problematic with TB is you have to follow it for 4 to 9 months. So it's a long-term thing. And the tobacco and vaping, we discussed that already. And that's it.
Okay. All right. Okay, Sandra, anything to add?
I do. The only one thing that I do have is that we are going to have the rabies clinic June 10th.
June 10th.
Yep, so, and a rain date of June 11th.
All right, great. So annual rabies clinic, June 10th.
Yes.
And that's going to be same place over at the Sachem.
Sachem, yes.
Council on Aging,
And the
yep.
flyer will be going out, and it'll be going up on our website shortly.
Very good. Okay.
And our next meeting too is March 18th.
Okay. Anything else?
Nope.
Okay. Okay, everybody, thanks for tuning in tonight, and that, I'll entertain a motion to adjourn our Board of Health meeting as of Monday, March 4th, 2024.
I'll make a motion to adjourn.
Okay, motion Andrew, second Lyons. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye. So that concludes our Board of Health meeting for Monday, March 4th, 2024. Okay, thank you.